So I love the quote from Hosea 4:6 that says, "My people are destroyed for lack of knowledge." It has become one of my favorite quotes, and it has really been sitting heavy with me and resonating with me. And so I'm making this video kind of off the fly. I did put some notes together because I don't want to get off on a passion tangent and turn this into an hour long just ramble. But my people are destroyed for lack of knowledge. And what I've noticed in my years practicing in pharmacy and just being a member of the community of the world is that most people don't have a medication problem and most people don't have a healthcare problem. Even though we talk a lot about access to care as being an issue, and I'm not, diminishing it, there are some access issues that are being worked on and others that need to be worked on. But at the core of it, most people don't have a medication problem and most people don't have a healthcare system problem. Most people have a knowledge problem. And so my people are destroyed for lack of knowledge. So I want to take it a step further and just kind of talk and go through my thought process and why I feel like knowledge by itself isn't enough. So we need that knowledge, and that's like step one, but it's not enough. And again, it's just really been resonating with me because I also heard the quote recently that most people don't have an access issue, they have an awareness issue. And that's what kind of drove me down this whole rabbit hole. And I took that a step further and turned it into what I'm calling my AAA mentality. And obviously, I'm not talking about the car company. This AAA framework or mentality stands for awareness, access, and action. And so awareness means that you even know what's going on. Are you even aware that you have a problem? If you are aware of that problem, do you know how to solve it? And do you know what tools you need in order to solve it? So just an awareness issue. Access means, can you actually get what you need to solve the problem that you're now aware of? Do you have access to the tools that you need? And access means, or excuse me, action means, are you going to do something about it? Or can you do something about it? So you're aware of it, you have access to it, and now you need to act on it. So awareness, access, action. So those are the 3 A's that I feel like everybody needs for this whole picture. And again, most people don't have an access issue. They don't have an access to care issue. They have an awareness issue, an awareness of what their care opportunities are, or an awareness of what their just general options are when it comes to accessing that care. So I want to talk through these one by one and kind of throw in some scenarios with them. So if you have one and not the other, or if you have two and not the third, then there's still going to be a problem. You need all three. You need awareness, access, and action in order for this whole picture to come together, in order for you to feel empowered and be the empowered and transformative person that you need to be, not want to be, that you need to be for your health. And especially in my sense, when it comes to medications and understanding those. All right, so you need all three. So let's think about a person who knows their blood pressure is high. They're aware. They know their blood pressure is high. They even have the pills in the cabinet. So they've got the access to the tool. Awareness, I have high blood pressure. Tool, medication, I have access to it. The action, though, are you taking it? No, I ain't take it today because I've been feeling pretty good, and I usually can tell when my blood pressure's high. That's the lie you tell yourself, because what we know to be a fact is that high blood pressure, hypertension, it has the name silent killer for a reason. And so if you're aware that you have high blood pressure, you have access to the tool to help it, but then you don't take the action, that's what leads to emergency room visits, money. That's what leads to unnecessary money, I should say. That's what leads to strokes, which could be debilitating. And you don't know, like, you can't decide what your stroke's going to look like. Some people have small strokes. Some people have larger strokes. And you don't get to pick, I'll take the small stroke just to make me more heightened in my awareness of the fact that this can happen. No, you could have a stroke tomorrow and lose all function of the left side of your body. And so leads to strokes, leads to blindness, kidney failure, all these things just because you didn't take action. So you were aware, you had access, but you didn't have the action. And I can take this a step further, because sometimes that action as I mentioned, it's kind of a circle. You need all three. Sometimes taking action on something depends on the awareness of what lack of action can lead to. So you may be aware that your blood pressure is high. You may have access to the pills, but you may not be taking action because you're not aware that you don't always feel your blood pressure high. You're not aware that there are these downstream effects of even a slightly elevated blood pressure that can cause you to have issues. And so that's why I say, it's all a cycle and we need all of them, because once you have awareness and access, and even if you're acting on it, then now you need to be aware of something else, because now if you act on it, now you're taking the pills. So you need to be aware of how they work and what are some of the issues that could come in play with the pills. So it all works together. Okay, I digress. Moving on to the next scenario. So say you have a person who has a drawer full of meds. They have full access, but they don't even know what half of them do. They don't take the time to figure out mechanistically how they work. And you don't have to be a physician or a pharmacist or a nurse or insert health profession here that learns about these drugs, because I don't want to leave anybody out, but you don't have to be in the healthcare field to have the authority to understand how your medications are working in your body. So this person has access to it, but they are not aware of how they work and how to take them properly, or if all of these medications can be taken together, or if they should be taken in the morning or at night, or sometimes they can't remember which pill does what, so they accidentally take the wrong one, and sometimes they don't take them at all. And so this access without awareness is dangerous. And this one hits really home for me because I think about my dad, and I'll keep telling the story time and time again because it is part of what fuels me. But my dad was one of those street savvy, individuals, a veteran, did all the things. But when it came to his health, he was very skeptical of the healthcare system. Part of that is just an awareness issue. And he also did not take his medications like he was supposed to. So he had them. And I was not a pharmacist yet when my dad passed away, but my mom was a nurse, and so she was just kind of looking at his pill bottles, and he was on a blood thinner, warfarin, which I don't love that name, blood thinner, but that's neither here nor there. So he was on warfarin, and he was also on a water pill, furosemide or Lasix. And this is because he had heart failure. And if you look at the pills, it looked like he was taking the warfarin incorrectly and not taking the furosemide at all. And so that led to fluid overload and just all kinds of issues. So I say all that to say, and that's the really short version of this longer story about my dad that I can go into, but he had access to the medications. He actually also acted on it. He was kind of taking them, but he lacked awareness of which one was supposed to be taken when and how and why. And ultimately, those things can be dangerous. So access without awareness, access and action without awareness can be dangerous. Moving on. If you have awareness without access, that can also be an issue. So you can be aware of something, and if you had access, you would act on it, but you don't have access. And so that's where this access to care thing comes into play, because there are many people out there who are aware that they need to have a procedure or that they need to go to the doctor, and they would act on that. They would do it if they had access. And again, I would even argue that they may not be aware of the access that they have, but that's just a different scenario. So in this scenario, they've got awareness, they would act on it, but they don't have access. So this can look like a person who needs insulin. They know they need insulin for their diabetes, but they can't afford it. So they don't have access to it. They would take the insulin the way they're supposed to, and they do take the insulin the way they're supposed to when they have it. But half of the time, they don't have access to it because they can't afford it, or they're having to stretch that insulin dose out, or that insulin dose out in order to make it last longer, so that they feel like they're doing something helpful for themselves because at least they're taking the medication. So in this situation, they're aware that they have diabetes, they need to take insulin. They act on it when they can, but when they are unable to act on it, it's because they have an access issue, and it could be due to financial. So that knowledge is just sitting there and crushing you because you've got somebody who's hungry, who's ready to act on something, but they just don't have the access to be able to do that. And that's an unfortunate place to be as well. And what I would say to those people is try to talk to people, try to talk to healthcare professionals, community organizations, and find out if there are ways to have that medication paid for, or if there are if financials is not the reason why you don't have access, maybe it's transportation or whatever, find out ways that you can get that access. Because I live in a smaller city, and we have so many intermediate steps to improve access for people, but a lot of people don't know about it. So they're aware that they need something, they would act on it, but they're not aware that they actually do have access if they would just tap into that resource. So here's what I want you to see. Awareness without action is just wasted awareness. Like, you know something, but you're not doing anything about it. That's just a waste. Access without awareness can be dangerous. So you have access to the medications, access to some information, but you're not aware of what the risks are, or you're not aware of, exactly what you're supposed to be doing correctly. And that can be an issue. And I've seen that in my own family. And then you've got people who act on things, but they're not aware and they don't have the right access. So they just out here willy-nilly doing things blindly, just acting on this and that. I think about this in the sense of people that take a lot of supplements. And I think supplements are great. I don't have anything against supplements. A lot of them aren't regulated, so people don't really fully understand what they're taking. But you've got people that really want to take supplements. And so they're trying to do something for their health. The intention is good, but they're not aware of how these medications could be affecting other things, or how those supplements could be affecting other medications or other parts of their body, or interacting with each other. And so now you've got somebody who's acting on something without awareness, and sometimes without access, or without perceived access to certain information. So again, when you put all three of these together, you've got a powerful thing that can lead to just a huge transformation in your life. And I'm talking about this in the sense of healthcare, but this could be applied to a lot of different things. If you are aware of what the issue is, or what the need is, and then you gain access to something that can help improve on that issue that you're aware of, and then you actually act on that thing that you now have gained access to that you were aware of, you've got the secret sauce. So those are the AAAs. And I'm not saying all this to make, anybody feel guilty about not tapping into one of these A's, or not capitalizing on one of these A's, because it's all up to us as a full system in healthcare, in our community. Like, we're all trying to work together for the greater good, but it is ultimately up to you. And nobody can make you do anything that you aren't ready, willing, and mentally prepared to do. And so it really takes a mind shift. And I'll talk about this mind shift in a different video, because I have a whole program devoted to shifting people's mindsets around medications and their healthcare. But again, we'll talk about that in a different video. And, I'll invite you all to attend a masterclass that I'll be having soon. But it takes a whole mind shift, because you have to know that you deserve to be aware of things, and you are able to be aware of things, and you deserve to have access to things, and you are able to have access to things, and you are able, and you should be willing to act on things. And so we live in a world now where things are at your fingertips. They're in your phone. They are on the internet. They're right down the street from your house. People will call you. Whatever it is, if you present a problem, we can probably make you aware of a solution. And so just being solution-minded, and finding out a way to tap into all three of these A's. So awareness, access, and action. Because one thing I know, and we said this saying before, people say it all the time, when you know better, you do better. It really should be, when you know better, you should do better, because most people know better and they don't do better. Because how many of us have access to be able to go outside and go for a walk? And we don't. And walking has been consistently shown to be one of the best ways to help with weight loss and help with just overall metabolic and cardiovascular health. And people don't do it, but there's sidewalks right there. So I won't go into any more stories or anecdotes, but the point is you get real shift and real transformation when you incorporate all three of these A's. So I'll land the plane here in just a minute, but I want to talk about a patient that really resonated with me, and it was really more so the caregiver of the patient, because I know that I'm speaking to people who are caregivers and are not the patients themselves, but this caregiver was the sister of one of my patients, and the patient was taking Coumadin, and so it's coming back to Coumadin, or warfarin is the other name for it. And I mean, she was just really skeptical of the whole drug, the whole healthcare system. And I remember her coming in, and the reason why I intervened, because I work in a clinic as a pharmacist, and I work with a lot of physicians in that clinic. But part of the reason I intervened is because one of the student physicians came to talk to me, and they were like, her brother is taking this medication. And I'm like, what dose? What doses are they taking? Because their INR, which is the monitoring level we look at, was really high, which could increase the risk of them having a bleeding in the gut, bleeding wherever. And so I'm like, well, what dose are they on? And the med student said they're on, she gives them two. She's just on 2. And I'm like, 2 what? 2 milligrams, 2 pills? And they're like, I don't know, just 2. She gives them 2 of them. And that's what she kept saying. I give them 2 of them. And so I'm like, okay. So I'm looking in the chart, and what I see in the chart is that the patient's supposed to be taking 10 milligrams. There's multiple different tablet strengths there. There's a 5 milligram tablet strength and a 10 milligram tablet strength. So I'm like, okay, is she giving him 2 of the 5s because the dose is supposed to be 10? If she's giving him 2 of the 10s, this level makes a lot more sense. If she's giving him 2 of the 5s, then that's a different approach of how we're going to manage this patient's medication. And so in this particular case, the sister was acting. She was giving him the medication, even though she didn't feel like she had all the knowledge that she wanted or needed in order to fully understand this medication. She knew, she was aware enough, so she had some awareness, some knowledge. So she was aware enough to know that her brother needed this and she needed to give it to him, and she was giving it to him. But she just didn't have the full awareness or the full knowledge that she needed. She also had access to the medication. And as a matter of fact, she had access to too much medication, because what I found out is that she had 5 milligrams at home, but they increased the dose to 10 milligrams. And I think she was told, I still don't even know the full backstory. I just had to correct the issue. But I think she was told to take 2 of the 5 milligrams and then switch to giving him the 10s. Well, she picked up these medications, and these pills are 2 different colors. But she just assumed that she just got a different color. Now, this is somebody who had interaction and access to her physician. She had interaction and access to the pharmacist when she went to pick up the medication. She could have gone back to the pharmacy to ask the question when she noticed that they were different colors. And she didn't. She didn't know what questions to ask. And that's another whole separate conversation about asking the right questions and just going in with a plan of how to ask the right questions. But long story long, it turns out that she was giving him 2 of the 10 milligrams. And it also turns out that she had another strength of pills at home, because at one point he was on 2.5. It was a whole ordeal. So what we ended up doing is I just had to scrap his whole treatment regimen. His INR was high, so we stopped the meds, started him back at an initial dose of 5 milligrams. And this led down me even giving a whole lecture with one of my colleagues to some of the trainees on, how to ask questions of patients to pull certain information out of them. But at the same time, you need to go in knowing what are the types of questions that you should ask as well. So again, if Hosea 4:6 says, my people are destroyed for lack of knowledge, then my AAA method says, don't stop at knowledge. Cultivate awareness. Make sure that you have access and that you are aware of the access that you have, and then take action. But take action with the full awareness of how to take that action appropriately. Knowing is not enough. You have to apply it. Having access is not enough. you have to have the right awareness and then have the right action tied to that access. So my challenge for you is to just look at your health today, look at your medications, look at everything related to your medical care, and ask yourself, are you missing one of these A's in any of those aspects, in any of those medications? Are you missing one of those A's? And if so, then this is your sign to close that gap. I am happy to answer questions. Hop into my community on YouTube where I will go in there and answer questions directly. I want to give the caveat that you always, always, always need to talk to your personal healthcare provider, whether that's your physician, nurse practitioner, physician's associate, or your nurse or your personal pharmacist. But I am here to be a guide. You have access to YouTube. It's free. I'm sitting here making this video. It is a service to YouTube. It is a service to you. If you need to hear somebody tell you to ask questions, to make sure that you have every piece of this AAA framework. So that's it. I still rambled for longer than I wanted to, but I am so serious and so passionate about this topic of making sure that people feel empowered to take care of themselves, and that they are aware of how to do that, that they have access to the things that they need, and that they take action on that, and that they are persuaded and transformed to take that action and not forced to take an action or blindly taking an action. And I do feel very convicted in that thought process. So that's all.